Hello and welcome to Mature Living. I'm Mary Yanez, Director of the Senior Adult Program. And of course, we've been on the air so many years and we love to invite people that can help us with our health care. As you know, as we get older, we need a little bit more attention. So we just want to invite and welcome, of course, Dr. Luis Guerra, who we've invited. And he is with Village Medical.
Yes.
And thank you, Dr. Guerra, for being here with us. And to tell us a little bit about yourself, a little bit about Village Medical, and the work that you're doing in this community.
Thank you and welcome. Thank you for inviting me. I was born and raised in Cuba. I left Cuba in 1980. I went to medical school in Puerto Rico. And then after finishing my medical school, I came to Texas Tech, El Paso, to do my internal medicine specialty. After I finished the training in internal medicine, I stayed about 5 years as a faculty member at the internal medicine department at Texas Tech University. And after that, I left to private practice. I have been in private practice since 1994. And recently, about a year ago, I made the great decision to join Village Medical, which is a great primary care group that we have the privilege to welcome in our beloved city, which is underserved, and we are in need of great primary care physicians, nurse practitioners, and physician assistants so that we can continue to deliver a great medical care to our community.
And who are some of the doctors that are in your group?
Yes, I belong to the Village Medical that is at Mesa Hills.
Okay.
It's called Mesa Hills Internal Medicine. And I have with me great doctors and great providers. They are Alex Ovalle, he's internal medicine. Hector Rodriguez, he is a family medicine. He's a recent graduated from the family medicine program. And after working 5 years in the community, he has joined a Village Medical. And then we have a wonderful nurse practitioner, Cristina Valles, and also a wonderful physician assistant, Lauren Catada.
Yeah. And I know you have a lot of outreach specialists that are reaching out to the community. And but I want to ask you about, and you know, I want to ask you now about the primary care and how you're reaching out through the Walgreens stores.
Yes. You know, when I was invited to talk to you, which to me is an honor and a privilege.
Oh, thank you,
I had seen you many times on TV, and I was wondering one day I will be meeting you. You know, it came sooner than expected. You know, everybody talks about primary care. You know, but what is primary care?
Yes.
You know, what is primary care? I think that primary care is to the basic medical needs that every human being needs through education, through prevention, and through the management of any chronic diseases that they might have.
Yes.
You know, basic primary care is the building block of a great life and a healthy life. Then we, Village Medical, we only provide primary care.
Yes.
And all my life, I have been practicing internal medicine or primary care in a fee-for-service model. But a year ago, I joined Village Medical, which the model is what we call value-based care. Value-based care is quality and not quantity. At value-based care, we're able to spend time, or the time that we need with our patient, to know them, to review the medication, to go through all the medical problems, to be sure that we give the education how to take the medication and how it's important for them to be compliant with the medical treatment and the medical follow-up.
Yes.
We have the chance to see the patient whenever we need. If I have a patient with uncontrolled diabetes or controlled hypertension, I can bring the patient with the help of my nurse practitioner or physician assistant. I can bring that patient in 1 week, in 2 weeks. We call the patient, we are in close contact with the patient because we know that that will be the success of the outcome, a healthier patient that will not have to go to an urgent care, emergency room, and also that the patient will not be admitted to the hospital for something that could have been avoided.
And all of us that have insurances need a primary care physician.
Yes.
And then if we get referrals, if we need any specialty, we need break a bone or something, we have a fracture, you send us to wherever we need to go. And so, do you take all kinds of insurances?
Yes, we take most insurance, and those that we are not taking at the present time, I think the administration is working very hard because we want to be here for everyone.
Yes.
For the one with insurance and those that don't have insurance, we are here to serve the community and to make it healthier.
Very good. And so Village Medical has been here for how long, more or less?
I would say probably close to 2 years.
I like the concept that you have your main office, but also you are based, you have representatives at Walgreens, at the different various Walgreens.
Yes, it was interesting.
Is that a new concept?
Yes, it was well, I don't know if it's a new concept because there are other offices, primary care offices that have opened at other pharmacies. However, the difference with Village Medical is these are beautiful, state-of-the-art medical offices in or within Walgreens.
Yes.
When a patient of mine thought that when he heard that I have joined Village Medical and that I was in a Walgreens, they thought that I would be in a corner with a little table and an umbrella.
That's what I was thinking. And I'm sorry, but that came to my mind.
Well, but you know what? These offices they hire the best architects. We have the best equipment with the patient in mind. We have geriatric chair in all our rooms, so that the patients can be very comfortable and they can do the EKG or they can do any procedure that we need to do in that chair. So that beautiful. Even though you don't go to Village Medical, I think that you should go and see those offices.
I'm going to go see it, definitely.
They have been done with a lot of love and with the patient in mind. Value-based care is for the patient.
You've sparked my interest already,
well,
Doctor.
Yes, it is.
And I like the fact that also you're bilingual. And,
yes.
And people will be served in the language that they are, their first language. And sometimes they struggle, especially the elders that don't know English. You'll be able to take care of them as well.
Yes, everyone in our office is bilingual, and those that are not fully bilingual are working very hard because they know that we want them to learn Spanish, especially, and our patients are extremely nice to them.
Very good. I really appreciate your time that you came to us. We still have some more questions. We've already covered insurance. We've covered the chronic, how you take care of your chronic illnesses and the referrals to specialists if necessary. And we're all needing a good team for our primary doctor visits, because that's the beginning. That's when we begin to talk and say, I'm feeling this, or I have a pain, or I have a lump, or whatever it may be, or I fell and I need I need to be checked. And we need somebody that will take us right away, not 2 or 3 weeks or a month or 2 months down the road, which happens sometimes.
Yes, no, we in our offices, we can have appointments the same day, the following day. And as I say, when our patient is already established with us at Village Medical, we'll see the patient whenever we need and how frequent we need in order to provide the care that they need.
Yes. Anything else that you'd like to share? Maybe a success story of how you're taking care of people in a very special way.
Well, I have so many stories, but I think that to me, I am extremely happy to see my patients that they have been treated with dignity, with respect, and that they appreciate what Village Medical is doing for us in El Paso. I have been practicing here, and I think that Village Medical have improved the quality of primary care, not only in our city, but in the United States with 22 markets and expanding at the present time.
Good.
And everyone that I have met at Village Medical, they're excellent people, they're smart people, but they have a great heart. And in our mind, the most important is the patient experience. And also, I want to point out that so far Village has given me and all the providers and the physicians all what we need in order to deliver the best primary care. And we know, and I know that the patient, and they have been telling me many times, what a difference when they come to our office or to any other village is they feel loved, they feel wanted, they feel that they are in the right place, and they feel and they know that they will be taken care the right way.
And the last thing is I'd like to give your phone number, or if you have your phone number, doctor,
Yes.
that you'd like to give of the office.
I want to point out, that we have 6 offices, but I will give the office number for the one at Mesa Hill.
Okay.
South Mesa Hill. It's 915-295-0344. 915-295-0344.
You got it, doctor. And then also I'll give the email for Guerra@villagemedical.com. That's easy.
That's correct.
Easy. And you also have a web page that I'd like to mention, but we'll show it on the screen so that people can write it down.
Yes, and also we have an app in which the patients can communicate with us any time of the day or at night. And also I think there, just point out before we finish, that accessibility, sometimes you can have primary care that is not accessible. One, the most important is Walgreens. Walgreens, why? Because the majority of us live within miles to a Walgreens. That the elderly patients, that they don't have transportation, it's easier for them to get to that clinic. Yes. Second, we open every day, Monday through Friday, Saturday and Sunday.
Very good. From
7 a.m. to 7 p.m. Monday through Friday, and 9 to 5 Saturday and Sunday.
Very good.
That we accommodate to the needs of our patients and families.
Excellent. And so the webpage is www.villagemedical.com. And thank you so much for being here, Doctor. We appreciate your visit and taking time from your busy day.
It's my pleasure.
But we want to invite you again to talk about some special things, maybe some specific things that we need to know as elders.
Anytime.
And how to take care of ourselves.
Anytime. Thank you very much.
Okay, we'll be back with more guests here on Mature Living. We really appreciate, remember, Village Medical. Well, thank you for staying with us here on Mature Living. We want to continue our conversation, and it's also about something that's going on right now and has been going on from October through, I believe, December or something like that, but we're going to get all the right information. And so we've invited David Martinez, who is the sales director for United Healthcare. We all have heard and have seen the commercials and probably know somebody that's under United Healthcare, as many other insurances in our community. But David, I think it's going to be good to explain to us what's going on right now. It's a special time, and what are they? Enrollment time, isn't it?
It's enrollment season, right? Not only are we gearing up for the holidays, but we're also right in the midst of enrollment season. So I'm happy to be here and kind of shed some light on what enrollment season is, what are our options at this point in time, and what we need to do during enrollment season.
David, we were talking a little bit. You cover quite a large area as a sales director. Tell me how you're working and who you're working with and what communities.
Right. So as you mentioned, I'm David Martinez. I'm the sales director for United Healthcare on the Medicare and retirement side of United Healthcare. So we specialize in our Medicare beneficiaries in our Medicare products. And so the territory that I oversee is the El Paso area, plus southern New Mexico, as well as our West Texas region. So all up into the Texas Panhandle and into the Permian Basin area. So it's a pretty extensive area. I do have a wonderful team that assists with me. So it's just not me out there working, but I have a team of managers throughout those markets, as well as a good field of agents that are out there ready and willing and able to explain benefits to our beneficiaries.
This is the big question, right?
Yeah.
What is enrollment period? Tell me, who needs to pay attention to what we're going to be talking about and why?
Yeah, so definitely. So enrollment season is, again, a very important time for our seniors, right? So anybody who is Medicare eligible, this is really the time for them to go in and review what plan they currently have, and review what plan they have, as well as looking at the changes that have been made. So each year, all carriers make changes and enhancements to their benefits. So this is really a good time for them to go in, check their plan, making sure that their health needs are still met with their current plan, as well as fitting their wallet as well. We know that financial aspects are taken into consideration during this time. So it's very important for our seniors to review the benefits at that time. But really, open enrollment or annual enrollment period begins October 15th and runs through December 7th. So we're right in the midst of enrollment season. So this is a perfect time for us to have this discussion to really help our seniors understand what is going on and help them review their benefits.
And I'm curious about why we have to do this. We have to have a plan. It's mandated, right? Do we get penalized if we don't? If you don't, how does that work?
Yeah, so as long as you have Medicare, original Medicare, you have the option to, one, stick with original Medicare, or you have the option to add some additional benefits through a Medicare Advantage plan, through a prescription drug plan, or even through a Medicare supplement plan. So again, this is really the opportunity to, if they have one of those plans, again, one is make sure that those plans still fit their needs.
Because our health changes as well.
Right, yeah, health changes
our
every year. Daily living, do we have new chronic conditions that we need to take into account? So we definitely want to review all those things. We know that Medicare is not a one-fits-all kind of plan, so we do want them to review those plan options and make sure that, again, those plans still fit their needs for this year.
What kinds of things do you offer?
Yeah, so we offer a wide range of benefits that are available to them. So a lot of, obviously, their doctor visits, their specialist visits, hospitalizations. So we take all those things into account. And again, those are a lot of things that original Medicare covers. But what United Healthcare offers and what private insurance companies offer are benefits above and beyond what original Medicare doesn't cover. So things such as dental, vision, hearing, even wellness plans as well, like fitness and gym memberships. Those are things that, again, our seniors are looking for that, again, original Medicare doesn't cover. So this is where, again, these private insurance companies such as United Healthcare come into play, right? And we help them and assist them with these additional benefits. So we're really proud to say with United Healthcare, we've made their enhancements to their benefits this year for anybody who is on a United Healthcare plan or people looking into United Healthcare. We've been able to keep our benefits stable and steady. We don't have any negative changes to our benefits. We're only enhancing them. So I think our beneficiaries are going to be really excited to see what United has to offer this year. I think dental is always top of mind, right? When it comes to our seniors, right? Taking care of our teeth and our mouth. So we've simplified our dental benefits this year, making sure that all non-cosmetic things are covered. So things that are really important, such as dentures, implants, root canals, crowns, all those things are covered this year, which is a big relief for our seniors. Sure. And then as well as vision, right? Making sure that they have their glasses and the equipment that they need to see, and hearing aids. We've simplified our hearing aids this year, reducing the copays and costs, because we know hearing aids are very expensive, right? So we've been able to stabilize that across all our plans to make sure that we're keeping the cost down low, as well as adding healthy options through keeping our seniors fit and healthy and active, right? So adding what we call the Renew Active plan to their benefits. So this gives them access to gyms and health facilities throughout the country. So not just in El Paso, right? If they're visiting loved ones in other parts of the country and they want to go to a facility to work out or do some exercise, they have that ability to go to those facilities.
They just show their card, or
they just show their card, and they're able to walk into any of the facilities that we accept.
I've also noticed that ARP, and United Healthcare are working together.
Yeah, so they endorse our health plans. We're actually the only carrier out in the market that ARP does endorse, through our health plan. So it is something that we keep to a highest esteem, that ARP is endorsing our health plans. Mm-hmm. But that's I know that can be some confusing at times. We aren't AARP, but AARP does endorse our benefits.
Yes. I've seen that on the commercials, so I have to mention that.
Right.
Now, okay, so the decision is ours.
Yes.
And it's a very important decision to consider all of the things that pertain to us and what our needs are, what prescription drugs or prescriptions we need, whether we want to go to a fitness center, whether we want to, get referrals, or, there's so much.
There's a lot of ins and outs. And that's why we ask every year, and this is why we review these things, right? To make sure that, again, all these things that our seniors are concerned about are covered, right? So we like to get our beneficiaries, our seniors, set up with a live local licensed agent, so that they can explain these benefits, right? And so when we do a needs analysis with our seniors, we're talking about head-to-toe needs analysis. So we're talking about, do they know even just the basics of Medicare, right? Do they know what Part A, what Part B, what Part C, what Part D, all the different parts? We want them to truly understand what each of these things actually means before we even talk about benefits, right?
Yes.
So really truly understand what Medicare is, how Medicare works, and then from there, let's talk about what the options are available to you. Do you want that freedom and flexibility of going in and out of network, or are you okay with a network of doctors but at a reduced cost to you, right? So again, costs are very important, making sure that, and then again, checking, do those plans have those things that they're looking for? Does it have that dental coverage that I'm looking for? Does it have the vision coverage that I'm looking for? And again, we know that, again, Medicare is not a one fits all kind of thing. So we want to do that full needs analysis and make sure that the plan fits their needs. And if it's a United Healthcare, wonderful. And if it's not United Healthcare, then again, let's help them refer them to one of the other carriers that are out there that could be a good fit for them.
That's good.
We want to make sure that our members are happy and satisfied at the end of the day.
And you have a phone number and you have locations. Tell us about that.
Yeah, so we have a location here in El Paso. We have our office right off of Executive. It's on Rio Bravo, so 4050 Rio Bravo. Suite 103 is where we're located. That's where our United Healthcare office is. But we have agents all throughout the region, in El Paso and in southern New Mexico. And so we meet with our clients wherever they want to be met, right? Okay. And so a lot of our clients sometimes are homebound. They can't go out and travel or attend some of our meetings that we have throughout the city. So we visit them in home or wherever they feel more comfortable. Maybe they want to meet at a daughter or son's house. So we go to them. So we meet them where their needs are best fit. So a lot of our appointments are done in home with the client at the comfort of their own home. And we'll do it that way. If not, we have, again, meetings throughout town, and we advertise those all through the newspaper and through direct mail. So we let our consumers know where we're going to be, when we're going to be there, so that they can get their questions answered.
And United Healthcare is one of the biggies, one of the superstars, I guess we could say, of healthcare.
Well, we're definitely, we're definitely one of the healthcare plans that are out there. And I'm very proud to say that we do have a very large enrollment basis here in the market. And I think that comes with, we've been in the market for many, many years. Our name has carried its weight. And again, consistency, I think, is the biggest thing. We're strong. We want to be the stable company for our Medicare beneficiaries. There's a lot of plans that come into the market each year. And again, it's good for our Medicare beneficiaries to learn what is out there, but know that United Healthcare has been here for many, many years now. This is actually my 12th year in the industry doing this.
Yeah. And you came out of one of our high schools,
I did.
The Silva Magnet.
Silva Magnet. Thought I was going to go into the healthcare aspect and become a doctor, but, kind of transition into the healthcare and taking care of our seniors.
Now.
So now 12 years in the Medicare industry. So, really learning in the ins and outs of what Medicare is. And I think a lot of that has to do with my grandparents and why I wanted to get into this, seeing them confused about, what Medicare is and what they're supposed to sign up with, it can be challenging. And again, we want to bring that simplicity to them and really help our seniors understand what Medicare is and making sure that they're on a good plan.
You certainly have convinced me here today, David. So thank you for that.
Absolutely.
And you also like to give your cell phone because you like that connection with the community. But there's also another number that I'm going to give, the 855-968-5806 that they can call. But
yes,
you wanted
absolutely.
to give your...
Absolutely. Well, that's our 1-800 number. That will get you in touch with any of our licensed agents over the phone, and they're happy to assist. But I know the community, sometimes, especially in El Paso, they want to talk to somebody local.
Yes.
And I'm with them on there. So yes, I'm absolutely happy to give my personal cell phone number. That is 915-920-8780. And I'll repeat it one more time. That's 915-920-8780. And again, that's my personal touch. Okay. Anytime that I'm talking to one of our seniors, it's like I'm talking to one of my grandparents. And I want them to be comfortable with who they're speaking to so that they know that they can speak directly to me and get their questions answered by, again, somebody who's here local and has their best interests at heart. That's really what we're here for.
And we're also going to give your information as far as david.martinez@uhc.com.
Right.
And then you have a website as well, but we'll put it on the screen.
Yeah, absolutely. They can reach us on our email address as well if they want to reach out that way, or again, reach out to our websites, UHC Medicare healthplans.com. They can get their information there as well.
We appreciate your visit,
Yes,
and I know
thank
you're
you,
busy.
Mary.
It's a busy time for you all,
It
so good
is.
luck.
Thank you very much, Mary.
And much success
Thank
in
you.
this community,
I appreciate
serving
it.
our seniors.
Yes.
And that's it for today. We're great. We feel good.
Good.
It's a good day, and so we'll see you all next week, and see you also soon.
Thank you, Mary.